All right, so welcome back for another deep dive. Today we are tackling pediatric health assessments. So, you know how healthcare providers gather information and examine kids
Yeah.
to kind of get a sense of their well-being?
Yes.
We've got some fascinating excerpts from a textbook chapter on this very topic.
Oh, cool. I think a lot of parents and caregivers could benefit from understanding this process.
Really?
Oh, yeah. Like if they get how it all works,
Uh-huh.
it could help them communicate better with the doctors and nurses and really advocate for their kids.
Oh, that's a good point. That's a really good point.
Yeah.
So the source material really emphasizes the health history part. It's like more than just filling out forms.
Oh, absolutely. It's about building a relationship,
Yeah.
Getting to know the child and their story. Like it's the first chapter in a book.
It gives you context. I
Exactly.
love this line from the source. It says, whatever the parent sees as a problem should be a concern of the nurse.
Oh, that's so important.
Isn't it?
Yeah, that open communication is key. Healthcare providers really need to listen, pay attention to what parents are saying and try to involve the child as much as they can, obviously, depending on how old they are.
Well, and speaking of age, the source goes into some specifics about how to talk to kids at different stages.
Oh, yeah.
Yeah, like for toddlers, it suggests letting them touch the equipment, to make them feel comfortable,
That's a good idea.
but obviously not needles or anything.
Right, of course.
And then for preschoolers, using really concrete language because they tend to take things so literally.
Oh, that's smart.
So can you give me an example of how that might actually play out, like in real life situations?
Sure. Imagine a toddler who's really scared of getting a shot.
Mm-hmm.
If you let them play with, a toy syringe first,
Yeah.
or even just show them how it works,
Yeah,
it might not be so scary for them.
right. It takes the mystery away.
Yeah, exactly.
And what about for a preschooler?
Okay, so instead of saying something like, was it draw some blood,
Right.
which could sound kind of scary to them,
Yeah, definitely.
you could say something like, we need a tiny drop of your blood to see how strong you are.
Oh, that's great.
Yeah.
I love that.
Yeah.
It just changes the whole framing of it.
Exactly.
So we've talked about the health history and making kids feel comfortable.
Right.
But then comes the actual physical exam.
Yeah.
Which, let's be honest, can be a little intimidating for kids.
Especially if they're not feeling well to begin with.
Exactly. And the source really stresses how important it is to make the whole experience as comfortable as possible.
Oh, for sure.
Like giving the child time to adjust to the environment, maybe involving them in the process a little bit, and, saving any uncomfortable or potentially painful procedures for last.
Yeah, that makes sense.
The source even talks about creating a safe space for kids in the hospital, bringing in familiar toys or pictures from home.
Yeah, a hospital can feel really strange and scary for a kid.
Oh,
Anything you can do to make it feel a bit more like home can help.
do you think that really reduces anxiety?
Oh, I think it can make a huge difference, yeah.
Okay, let's dive into the actual physical exam.
Okay.
The source breaks it down step by step.
Uh-huh.
And there are some things in here that I think people might find surprising.
Really?
Yeah. Did you know that for kids older than 3, they actually check their blood pressure at every single healthcare visit?
Wow. Every time.
Every time. It seems like a bit much, doesn't it?
Yeah, it does.
But apparently it's become standard practice.
Well, I guess it's good to catch things early.
Right. And high blood pressure can be serious, even in kids.
Yeah,
And I guess it's a pretty quick and painless procedure.
true.
The source also talks about how important it is to use the right size blood pressure cuff.
Oh, yeah, I've heard about that.
They say even a small difference in size can really throw off the readings.
I can imagine.
It's like, imagine trying to squeeze a garden hose onto a fire hydrant.
Uh-huh.
That's what using a too small cuff is like for a child's arm.
Oh, okay, I get it.
So the reading would be totally off.
Makes sense.
When it comes to assessing pain,
Mm-hmm.
I was really interested in how they use the Wong-Baker Faces Pain Scale.
Oh, yeah, the faces.
Yeah, it's this chart with faces ranging from happy to crying,
Uh,
and it helps kids, especially younger ones, express how much pain they're in.
it's a really simple but effective tool,
It is.
especially for kids who might not have the words to explain what they're feeling.
Yeah.
I remember one time this little boy pointed to the face with the biggest smile and said, "This is how much my tummy hurts."
Oh, wow.
Turned out he was just constipated,
Oh,
but the scale helped us figure it out.
that's great. So it can be helpful in lots of different situations.
Yeah, definitely.
I wish they had that when I was a kid.
Me too.
Okay, so we've covered communicating with kids,
Right.
making them feel comfortable during exams.
Mm-hmm.
But let's shift gears and talk about nutrition. I think this is something a lot of parents are worried about these days.
Yeah, for sure.
The source mentions that rates of overweight and obesity in kids are on the rise.
It's definitely a big concern.
It is, especially because of the long-term health impacts.
Absolutely.
So that's why those nutritional assessments are so important.
Yeah, we're looking at more than just weight, you know? We also consider their eating habits, their feeding routines, and even family history.
The source really emphasizes comparing a child's current weight to their previous measurements to track their growth and catch any problems early.
Yeah, that's key.
It even mentions a couple of resources with more in-depth info, Box 4.8 and Table 4.1.
Okay.
But we won't get into all those details today.
Right.
What struck me is that it's about way more than just a number on a scale.
Oh, definitely. It's not just about what they eat, but also the environment around food.
Oh, interesting.
Family mealtime routines, stress levels at home. All that can have a big impact on a child's relationship with food.
Wow, I never thought of it that way.
Yeah, it's all connected.
So it sounds like it's a more collaborative approach.
Yeah, absolutely.
Involving the healthcare provider, the child, and the parents.
Exactly. It's a team effort.
We've talked about the health history, the physical exam, nutrition. Now it's time to get hands-on and explore the amazing machine that is a child's body.
I like that. Amazing machine.
It is.
Let's dive into the different body systems they examine.
Okay.
See what clues we can uncover.
The source walks us through the exam of the skin, head and neck, ears, eyes, mouth, and so on. I was fascinated by the part about inspecting fontanelles in infants.
Oh, yeah, the soft spots.
Exactly. They're like little windows into the brain.
That's a good way to put it.
Making sure everything's growing properly.
Yeah, it's amazing how much you can learn just from looking.
And another thing that caught my eye is that they check reflexes in kids of all ages.
Really? Not just newborns?
Nope, not just newborns.
Huh, that's interesting.
Which makes sense when you think about it. Reflexes are a good indicator of how the nervous system is developing.
That's true.
So it's not just about looking for problems, but also understanding the child's development.
Right, and identifying any potential concerns that might need further attention.
Exactly. Every little detail matters.
It really does.
This is all so fascinating. But before we go too much further down this rabbit hole, I think we need to take a quick break.
All right.
We'll come back and explore the rest of those body systems in our next segment.
Sounds good.
See you then.
See ya. It's pretty amazing how all these different assessments, like from checking reflexes to examining ears, contribute to the bigger picture of the child's overall health.
It's like each piece of the exam is part of a puzzle, and the healthcare provider is trying to put it all together.
That's a great way to think about it. And just like with a puzzle, sometimes one missing piece can make it hard to see the whole image.
So true, so true.
Yeah.
Let's talk about some of the specific systems. When it comes to the thorax and lungs, what are healthcare providers listening for?
Well, you can think of a doctor as like a sound detective.
Oh, I like that.
For little lungs, listening for clues.
Okay.
Like wheezing.
Yeah.
That might mean a narrowed airway, while crackles could mean fluid buildup.
Wow.
They also look at the shape and movement of the chest, making sure both sides are expanding equally with each breath.
They really are detectives.
They are.
So they're gathering so much info just from listening and observing. What about the heart?
Yeah.
Checking the pulse seems pretty straightforward.
It is, but there's more to it than just counting beats per minute.
Oh, really?
They also got to assess the rhythm, the strength of the pulse, and listening with a stethoscope can reveal even more, you know?
Like what?
Like a trained ear can pick up subtle murmurs.
Oh,
or irregularities that might need more investigation.
It's like they're deciphering a secret code.
Exactly.
What about the abdomen?
All right, so for the abdomen, they're checking for signs of tenderness, swelling, or organ enlargement.
Okay.
They look at the symmetry, the shape, listen for bowel sounds, gently press on different areas.
All that poking and prodding, I bet that's not very comfortable for a kid.
You're right, it can be, which is why it's important for healthcare providers to explain what they're doing in a way that kids understand.
Right.
A gentle touch and keeping the child engaged can help a lot too.
So they're trying to rule out any problems with the digestive system.
Exactly, looking for clues that might point to constipation, diarrhea, or even more serious stuff like appendicitis.
And then, of course, no pediatric assessment would be complete without examining the genitalia and anus.
Right.
That must be a really sensitive part of the exam for kids.
It is. And it's super important for healthcare providers to approach this with a lot of care and sensitivity, explaining everything they're doing in age-appropriate language and making sure the child feels safe and comfortable.
Sounds like a tough balance.
It is.
Between being thorough and being sensitive.
Yeah, for sure.
The source also mentions checking the spine for curvature and the extremities for muscle strength and range of motion.
Right. That's all part of checking the child's musculoskeletal development.
So they're looking at how the joints are moving, making sure the spine is straight, checking for any weakness or asymmetry.
Exactly.
Wow, they really are examining them from head to toe.
They are.
And finally, we come to the neurological assessment.
Okay, so for this one, we're evaluating things like thinking skills, speech, awareness of their surroundings, and emotional state.
Wow.
And for school-aged kids, we even ask about how they're doing in school.
Oh, that's a good idea.
Yeah, it gives us some insights into their cognitive abilities and social-emotional well-being.
So they're not just focused on physical health, but also cognitive and emotional development.
It's all connected.
It is. And of course, they also check balance and coordination.
Yeah, which can tell us a lot about their neurological function.
Those reflexes we talked about earlier, those come into play here too.
Absolutely.
We've covered so much ground today.
We have.
It's clear that a pediatric health assessment is about way more than just taking vital signs.
Right. It's really about understanding the whole child, their physical health, development, emotional well-being.
We've talked about all the components of a pediatric health assessment.
Yeah.
But I'm curious, how do healthcare providers actually do all this in a typical checkup?
That's a great question.
Especially with a squirmy toddler.
Yeah.
Or a shy preschooler. It seems like it would take forever.
It takes a lot of skill, patience, and definitely some creativity.
So how do they do it?
Experienced healthcare providers are like masters of distraction.
Oh, that's funny.
They use toys, games, and even conversation to keep kids engaged and comfortable throughout the exam.
That makes sense.
They're also really good at working quickly and efficiently.
They have to be.
Making the most of every moment.
So it's all about adapting the assessment to the individual child.
Exactly. There's no one-size-fits-all approach.
Right.
It's about building rapport, being flexible, and tailoring the exam to each kid's unique situation.
Building a strong relationship with the child and their family, that must be a crucial part of this whole process.
Oh, absolutely. When kids feel safe and trust their healthcare provider, they're way more likely to cooperate and be open during the exam.
That's so true.
And when parents feel heard and respected, they're more likely to be involved in their child's care.
This makes me think about how important it is to find a healthcare provider who's a good fit for your family.
Yeah, 100%.
Someone you feel comfortable with and who you trust to care for your child.
Couldn't agree more. Finding the right healthcare provider can make all the difference.
We've explored a lot when it comes to pediatric health assessments.
We have.
And I feel so much more informed now.
Me too.
But before we wrap up, I think it's time to talk about what this all means for you, the listener.
Okay, sounds good.
We've really gone deep on pediatric health assessments, haven't we?
We have, from the health history to the physical exam.
It's incredible how much goes into these assessments.
It is.
It's not just listening to their heart or checking reflexes. It's about getting to know the whole child. Their physical health, developments, emotional state, even their family dynamics.
Yeah, it's really a holistic approach.
Recognizing how everything is connected.
Exactly.
So as we wrap up this deep dive, what are some key takeaways for you?
I think the biggest one for me is realizing how important parents and caregivers are in this process.
Right.
You're not just watching from the sidelines, you're active participants in your child's health care.
And that's why it's so crucial for parents to understand these assessments.
Absolutely.
The more you know, the better you can advocate for your child.
It's all about being empowered. When you understand the process, you can ask good questions, share your observations, and work with your child's healthcare provider.
Right. It's a team effort. So here's something to think about for our listeners.
Okay.
Think about your child's next checkup. What questions do you want to ask their doctor or nurse?
That's a great question.
What information would make you feel more confident and informed?
Yeah, remember, there's no such thing as a silly question.
Right.
When it comes to your child's well-being.
Exactly. And don't be afraid to speak up.
Yeah. Share any concerns you have.
Your voice matters.
Absolutely.
It's been fantastic exploring this topic with you.
It has.
I think we both learned a lot.
Definitely. I always enjoy talking about these things.
Yeah.
And hopefully giving parents and caregivers some helpful information.
Well said.
Thanks for having me.
Thank you for joining us on this deep dive We hope you found it insightful.
Yes.
Until next time, take care.
And keep those curious minds engaged.